Welcome to HiNZ 2018. I'm here talking to Stefan Wijnen. And Stefan is the Business Development Manager, Microsoft InnerEye, based in Belgium, and traveling all around the globe with this most fascinating project. And I had the pleasure of listening in this morning to your paper, Stefan, and found it absolutely fascinating. You're currently working with Auckland Hospital on InnerEye, I believe, as you mentioned it as well. So you described it as machine learning cloud services to assist medical experts. It's probably an oversimplification for what it really is, because it's much more than that. But I found it. So can you give us some highlights of InnerEye and your experiences?
Sure, so indeed, the project is part of Microsoft research. So it is not something that you can take off the shelf right now at Microsoft. It is still research. Research that is really focusing on doing the segmentation in 3D medical images. Think about CT scans, think about MR scans. Why is this important, segmentation in 3D medical images? We started working with a radiation oncologist in the Addenbrooke's Hospital in the UK, so the Cambridge University Hospital. And a radiation oncologist has to make sure that the radiation itself will hit the target. But all the surrounding organs should be protected as much as possible. You want to reduce the toxicity in those organs from the radiation, for obvious reasons. So to do that, you have to take a planning scan from the patient. And then once that you have this planning scan, you have to go through this scan slice by slice, creating the contours around the different organs of interest. And that can be extremely time-consuming. If we are talking about an easy case, let's say somebody who has prostate cancer, it can take up to 45 minutes. You know, a highly paid radiation oncologist or dosimetrist has to do something like paintbrush in a certain way, really circling around the different organs. The beauty is with the machine learning and the algorithm as developed in the Cambridge lab, Microsoft Research Cambridge lab, we are now able to do that work, reduce the time for doing that work to, let's say, a few minutes. So the machine learning itself will take roughly a minute. And then you might have to look through all the different slices and the contours created by the machine learning, and you might have to do some fix-up. So, and that is really important to understand. The professional who's working with the tools is also the responsible person. So the machine learning will not take away your job, which is sometimes a rumor that you can hear in the hallways. Instead, the machine learning is augment your skills, but you are the responsible person. So you have to go through the results and have to approve it before taking it to the next step, which can then for radiation oncology, let's say the dose calculation, and then of course you can start with the treatment of the patient itself. At the same time, this technology can be used also in other areas within the medical space. Think about radiology itself, longitudinal lesion tracking. How is the tumor evolving over time? Is it growing? Is it shrinking? And can we quantify that? Can we really do the volume calculations on these lesions and see how the lesion is evolving? Is it responding to a treatment or not? Another area would be surgery, robot surgery and orthopedic surgery. Especially for the surgery planning, there is a lot of interest in segmentation. Why? If let's say that you have to do robot surgery on a kidney of a patient with a lesion, then you want to know the shape of the kidneys, where the lesion is exactly, how the arteries are going to the kidney, and so on. You want to make sure that you have immediately your target within sight, and at the same time want to protect also the the blood vessels and so on, to reduce bleeding and other side effects that such a surgery might have. Just in a nutshell what the technology is all about.
In terms of you showed us some examples of a couple of the oncologists who've managed to save not so much time. How is their acceptance of it? And is there skepticism initially of the machine learning? How do they get to the point where they accept the machine learning?
Well, that is an excellent question. It makes sense for a professional to use a tool if it is making him more productive, if he gets benefits out of it. If you look to existing auto-segmentation tools in the market today, the results were simply not good enough. So the radiation oncologists that I've talked to said, look, for us it is easier to start from scratch instead of accepting what was created in the past by these other tools, because, yeah, it was way off of what we expected. So I think we have to create at least a certain level of accuracy so that the people are saying, well, this really makes sense. I can start from that point and then move on and just do some fix up and we have perfectly segmented contours. It is described as a DICE score. And it is widely accepted that for the hard structures, the bony structures, you should have at least a 95% DICE score. For the soft tissues like the bladder or the liver, those kind of things, you should go to, let's say, 80-85% and higher. And then the people are satisfied with the results and they will do the fix-up. If you are below those numbers, it will become difficult. So in my discussions with the professionals in the field, all of them are really excited about the idea using machine learning, using artificial intelligence on 3D medical images to make them more productive. They are, of course, a little bit skeptical. They want to see the results first. But at the same time, all of them want to collaborate to make sure that we get better and better results. It is machine learning, so we have to learn from something. Microsoft is collaborating at the moment with roughly about 30 hospitals worldwide, and indeed Auckland Radiation Oncology is one of them, really to get clinical feedback on the models that we have created. And on the other hand, also they provide us with training material, so images with perfect segmentation information that we can use to optimize our models. And these models then will become better and better with more accurate results.
And when you talked about some of the applications with respect to the robot surgery, orthopedics, and so on, you're starting with radiation oncology. That seems to be the fundamental one. What next in terms of the applications?
Yes, so radiation oncology is indeed our beachhead, which is a clearly identified need for segmentation. So the workflow as such is not changing for these people. It is simply faster now with an automated tool. The next area of interest would be indeed radiology, where the specialists at the moment typically eyeballing images. They are looking at images and they say, okay, I see how the tumor is evolving over time, but I think we can do better. Instead of eyeballing images and taking very basic measurements like RECIST, we can now do volume calculations. So really identify the size of the tumor by volume and not simply by measuring it. Once that you have that, you can pre-populate a radiology report with a graph where you can see how certain areas of interest are evolving. The volume is one thing, texture, density, those kind of things are other parameters that you can take out of those images. So suddenly your image becomes a measurement tool, going beyond simply being an image. It is really becoming a measurement tool, and that is super exciting, I think. And then indeed, like you mentioned, orthopedic surgery, robot surgery is another area of interest. We are talking to many of these players out there to integrate our solution. Microsoft has no ambition to bring out first-party solutions and sell that directly to medical centers and so on. Instead, what we really would like to do is integrating with all the players out there so that those applications that you are used to work with already suddenly have a new feature, which is the auto-segmentation feature. As such, you can continue working in the tools that you have with the interface that you know, but with a few more possibilities. And I think more functionality, and it helps a lot also for clinicians to adopt those solutions. And that is what we would like to do, really teaming up with those players and making sure that they can adopt InnerEye, the machine learning.
Stuff on InnerEye is just fascinating. It will make a difference. It's already making a difference, which must be very rewarding. And working in that space. So I wish you the very best of luck with it. And thank you for coming along.
It was a pleasure.
Thank you. And your presentation and slides are going to be available on the HiNZ website for people to listen to the full presentation. So thank you very much.